Hello, this is Dr. Joe Muscolino. The following is an AI-generated simulated podcast of the contents of my ebook. I've created this and providing this because I believe that it is a very casual way and a comfortable way of listening to and absorbing the information. I hope you do enjoy it.
Okay, so have you ever just been going about your day and suddenly bam, this shooting pain in your leg just hits you out of nowhere?
Oh, yeah.
It's awful. Well, that might be sciatica rearing its ugly head, and trust me, it's way more than just a pain in the well, you know?
Yeah, for sure.
And today we are diving deep into this whole world of sciatica with a little help from a fantastic guide. A Comprehensive Manual Therapy Treatment Guide for Sciatica by Dr. Joe Muscolino.
Great source.
It really is. And by the end of this deep dive, you're going to be armed with all the knowledge you need to understand the surprisingly common condition. We'll debunk some myths, figure out why it's often misdiagnosed, and hopefully give you the tools to tackle it head on.
I love it. It's like putting on our detective hats and really getting to the bottom of what's causing that leg pain.
Yeah, exactly. And speaking of getting to the bottom of things, the biggest aha moment for me from Dr. Muscolino's guide was the sciatica. It's not the actual problem.
Right.
It's a symptom.
It's like a check engine light.
Yes, a screaming signal, a distress call from your body that something else is going on.
And so often we just focus on silencing that alarm bell instead of figuring out what's actually setting it off.
Right. So then what is sciatica if it's not the actual problem? Well, Dr. Muscolino describes the sciatic nerve, get this, as a massive information superhighway. And it runs all the way from your lower back through your glutes and branches down to your feet.
It's essentially this massive cable carrying tons of information, controlling everything from feeling sensations to making those leg muscles move.
It's kind of mind-blowing when you think about how much this one nerve is responsible for.
It really is.
Yeah.
And Dr. Muscolino lays it all out in detail. The nerve's path, how it weaves around and through different muscles. It's pretty fascinating stuff.
Yeah, and it really highlights just how complex and interconnected this whole system is, because when something goes wrong along that pathway, that's when the trouble starts.
Exactly. And the guide even goes into the science of it, talking about motor and sensory innervation, which sounds super complicated. But basically your sciatic nerve, it's responsible for both feeling things in your leg, A and D, telling those muscles how to move.
So it's a two-way street.
Exactly. And if that nerve gets compressed, pinched, irritated in any way, well, it can create a whole cascade of issues.
And that's where we get to the heart of the matter. What is causing your sciatica? Because, spoiler alert, it's not always what you might think. So we've got this nerve, right? The super important nerve running down your leg. And like any good mystery, there's got to be a culprit or culprits causing the sciatica drama.
Right. And luckily, Dr. Muscolino lays out some of the usual suspects in his guide.
Yeah, he gives us a whole lineup.
And the interesting thing is each of those suspects, they can trigger sciatica, but the way it feels, the actual symptoms you experience that can really vary depending on what's going on in there.
Oh, that's fascinating.
Right. So it's not a one-size-fits-all kind of pain.
Okay, so it's like a game of sciatica clue. Was it the herniated disc in the gym with the lead pipe, or maybe the bone spur on the yoga mat?
I love that analogy. But yeah, let's break down some of these suspects, starting with those herniated discs. We've all heard the horror stories, but the source actually explains it really well.
Yeah, because I think a lot of people, they hear herniated disc and they picture I don't know, their spine exploding or something.
Right, it sounds terrifying.
Yeah.
But think of it like this. Imagine a jelly donut.
Okay, I'm with you.
Now picture that jelly pushing out through the dough.
Okay, could get messy.
Exactly. That's kind of what happens with the herniated disc. The inner part of the disc bulges out, and if that bulge happens to be pressing on one of those nerve roots that form the sciatic nerve, well,
Ouch.
yeah, ouch is right.
Yeah.
That's when you get the pain, the numbness, the tingling, sometimes even weakness in the leg.
So what about bone spurs? They sound kind of scary too, like little daggers on your spine.
I know the name doesn't help, but they're not as menacing as they sound.
Mm-hmm.
It's basically just an overgrowth of bone, often happens with age or wear and tear.
So like your bones are trying to sprout little bony wings.
Yeah, you could think of it that way. And just like with a herniated disc, if that bone spur starts poking at the sciatic nerve.
Crabba.
Exactly.
Yeah.
And then, of course, we have the infamous piriformis muscle.
Ah, yes, the piriformis. This one always seems to come up when we're talking about sciatica. What's the deal with this muscle? Why is it such a troublemaker?
So this muscle, it runs right through your buttock area. And here's where it gets interesting. Dr. Muscolino points out that in some people, about 15%, the sciatic nerve actually pierces right through this muscle.
Wait, what? It goes through the muscle.
Yep, right through it.
Talk about being in the wrong place at the wrong time.
Right. So you can imagine if that piriformis muscle gets tight inflamed, it's like squeezing a hose that your sciatic nerve is trying to run through.
Oh man, that's a recipe for disaster.
Exactly. So we've got herniated discs, bone spurs, this tricky piriformis muscle, all these potential culprits lurking around your sciatic nerve. And they can all cause trouble.
So how in the world do we figure out which one is the bad guy in our own personal sciatica story? So we've got our lineup of suspects, each one capable of causing some serious sciatic drama. But how do we figure out who the main villain is in our own personal sciatica story?
Well, that's where the real detective work comes in. Dr. Muscolino talks about these assessment tests. They sound kind of intimidating, but he describes them in a way that makes them seem almost like a game, you know?
A game. Tell me more.
So one of the classics is the straight leg raise test. You lie down on your back, nice and relaxed, and the doctor gently lifts your leg. Sounds simple enough, right?
Yeah, it doesn't sound too bad.
But if there's any compression on your sciatic nerve, that stretch can send pain shooting all the way down your leg.
It's like they're pulling on a string that's connected right to the source of the problem.
Exactly. And then there's the slump test. You're sitting down and you kind of fold forward like you're trying to touch your toes.
Oh yeah, I've done that stretch before.
Again, it's all about stretching that nerve pathway and seeing if it triggers that telltale pain.
So simple, yet so clever.
Right. Our bodies have a funny way of revealing what's wrong when we know how to look.
Absolutely. So we've got the straight leg raise, the slump test. Any other games doctors like to play?
Well, Dr. Muscolino also mentions the cough test,
Yeah.
which I'm sure we've all experienced at some point without even realizing it's a sciatica clue.
Okay, you're going to have to explain this one.
You know that sudden jolt of pain you might feel when you cough or sneeze?
Oh yeah, I've definitely been there. Never thought of it as a sciatica clue though.
Well, it makes sense when you think about it. Coughing or straining increases the pressure in your abdomen,
Right.
right? And that pressure can actually impact the nerves exiting your spine. So if you already have some compression going
That's
on.
turning up the volume on that pain signal.
Hmm.
Makes sense. So we've got these hands-on tests, which sound incredibly insightful. But Dr. Muscolino also mentions that doctors have some high-tech tools at their disposal too, right?
Oh, absolutely. We're talking MRIs, CT scans.
Yeah.
Those give doctors a literal picture of what's happening inside your spine.
So it's like having X-ray vision for your spine.
Exactly. They can see if there's a herniated disc, a bone spur, anything that might be pressing on that sciatic nerve.
And once you have that clear picture of what's causing the problem, you can start talking about treatment.
Precisely. And that's something Dr. Muscolino really emphasizes throughout the guide. Treatment isn't a one-size-fits-all kind of deal. It completely depends on what's at the root of your sciatica.
Which makes perfect sense. A herniated disc needs a different approach than, say, a tight piriformis muscle.
Absolutely. Dr. Muscolino, he's really big on manual therapy, which involves hands-on techniques to ease muscle tension, improve joint mobility, ultimately take pressure off that poor, irritated nerve. He even talks about this patient, Armin, an office manager who was really struggling with sciatica.
Oh, tell me about Armin. I think a lot of our listeners can probably relate to that whole office worker situation.
Oh, for sure. So Armin, he's dealing with this constant nagging sciatica, and it turns out he's got a combo of things going on. A mild disc bulge, plus super tight back muscles, probably from sitting at his desk all day.
Classic desk job dilemma.
Exactly. And because he had multiple things going on, he needed a multi-pronged approach to treatment. He worked with his doctor to address the disc issue and also did manual therapy to loosen those tight back muscles.
How did it go?
It worked. Armin's pain significantly decreased, and he was able to get back to living his life.
That's fantastic. It really shows how important it is to get a proper diagnosis and a personalized treatment plan.
Couldn't agree more. There's hope for relief. Sciatica might be incredibly common, but it's not something you just have to live with.
So before we wrap up this deep dive into the world of sciatica, what are the key takeaways you want our listeners to remember?
First and foremost, sciatica is a symptom, not a diagnosis in and of itself. So if you're experiencing that shooting leg pain, don't ignore it. See a doctor, figure out what's really going on. Knowledge is power, right?
Absolutely. And once you understand the root cause, you can explore those treatment options.
Exactly. Whether it's physiotherapy, manual therapy, medication, there are options out there. The key is finding what works best for you and your specific situation.
And on that note, we'd love to hear from you. Have you dealt with sciatica? What helped you find relief? Share your experiences with us. And remember, a little knowledge can go a long way, especially when it comes to something as common and often misunderstood as sciatica. Thanks for joining us for this deep dive. We'll catch you next time.
This is Dr. Joe Muscolino again. You've just listened to the AI-generated simulated podcast of the contents located within the ebook. I hope you enjoyed listening to this podcast and you found it informational. Thank you.